The cat-cow stretch appears in almost every spinal rehabilitation program, but it is not automatically the right exercise for every presentation. Knowing who benefits most, who needs to modify the movement, and who should get a physiotherapy assessment before starting is as important as knowing how to perform it correctly. Let me walk you through each of these categories in clinical detail. The clearest indication for cat-cow is chronic flexion bias posture. Any lifestyle dominated by sustained sitting, prolonged driving, desk work, or forward-leaning activity. These postures gradually bias the spine toward flexion throughout the day. The posterior spinal muscles accumulate sustained tension. The lumbar and thoracic facet joints stiffen in their compressed end range, and the intervertebral discs load asymmetrically over hours. Daily cat-cow directly counters all three of these effects by cycling the spine through controlled flexion and extension. It restores the segmental mobility that sustained posture progressively erodes. The improvement is gradual and compounds across weeks of consistent practice. Most people notice reduced morning stiffness by week 2 and improved mobility in daily movements by week 4 to 6. The second strong indication is thoracic hyperkyphosis, the rounded upper back that develops in desk workers, students, and those in forward posture occupations over years. Thoracic hyperkyphosis restricts thoracic extension, which is one of the hardest movements to improve through passive stretching alone. The thoracic cage makes the thoracic spine inherently resistant to extension because the rib attachments limit available range and resist the forces that passive stretches apply. The repeated active extension of cat-cow, sustained over weeks of daily practice, is one of the most accessible tools for gradually improving this restriction. For early morning stiffness that resolves with movement, cat-cow is most effective before rising, at the moment of peak disc hydration described in the previous video. For facet joint irritation, cat-cow's alternating loading and unloading of the posterior joint surfaces reduces the sustained compression that drives much of the deep aching in this presentation. Many patients with facet-related back pain find that their morning pain resolves meaningfully faster on days they complete the routine before standing. For disc herniations, the appropriateness of cat-cow depends on the direction that either relieves or provokes your symptoms. Most people with posterior disc herniations feel better with extension and worse with flexion. For that pattern, a cow-dominant routine that minimizes full cat flexion gives the mobilization benefit while following the directional preference. If flexion relieves and extension aggravates your symptoms, a cat-dominant routine is the appropriate modification. This reverse pattern is less common but occurs in anterior and foraminal herniations, and identifying which applies to you is one of the first things a physiotherapy assessment determines. The overriding principle is to follow your directional preference, especially in the first few weeks, until assessment clarifies what is driving the pattern. For people who are pregnant or postpartum, cat-cow is generally safe and specifically beneficial for the thoracolumbar load that pregnancy and feeding postures generate, but the wrist loading position should be modified if there is carpal tunnel involvement. 3 presentations genuinely need guidance or modification before beginning. Spondylolisthesis, where one vertebra has slipped forward on the level below, requires caution with the cow extension component, as lumbar extension loading can stress the pars defect often present in this condition. For osteoporosis, cat flexion requires guidance because forward loading increases vertebral compression forces. The severity of restriction depends on bone density, and a physiotherapist can advise on the appropriate range for your specific result. For people in the acute phase of a significant disc herniation, severe radiating leg pain, progressive numbness, significant antalgic posture, directional preference should be established under clinical supervision before cat-cow is used as self-management. 3 minutes per morning is a sustainable time commitment, and the change it produces is cumulative. It compounds meaningfully across weeks and months of consistent daily practice. Patients who complete the morning routine every day for 8 weeks consistently describe improved spinal mobility in activities they had stopped associating with their back at all, reaching into high cabinets, reversing the car, tying their shoes without bracing. The link in the description has the full exercise guide and a self-assessment to help identify which modifications apply to you.